Guys, this is Dr. Jeff Newman, and we're going to talk about sleeping positions that you've got to avoid. So, out of all the years that I've been working, the only position that patients have seemed to have trouble recovering in is if they're stomach sleepers. People that are laying on their stomachs end up having their head rotated to the side for long periods of time. I mean, if you're sleeping for the recommended 8 hours a night, then that means that your head's rotated to one side or the other if you're laying on your stomach. And sometimes patients' necks will become favored to that side. They'll have a little straining to either the right or the left, whatever position they're laying in. And I typically ask if someone's got a lot of neck issues going on, do you like sleeping on your stomach? And I typically guess which side they tend to prefer their head to, because their neck spine will actually be slightly rotated to that direction. All right, and then we'll work on improving the muscular tissue and the spinal mobility in the cervical spine to help with those issues. But one of the first things we do is try to get that patient on their side. All right, I prefer to side sleep. Some patients do great when they're lying on their back. People that lie on their backs prefer pillows that kind of wrap around their head and support their head here so that you're not rolling from one side or the other. And then patients that lay on their side like to have a support here, a pillow that's supported not too high, not too low. And then one of the keys with side sleepers is trying to get a pillow or something between your arms. The key to being on your side is not having your shoulders too close together. The more I can square my shoulders like this, the better off my neck issues are going to be. My neck issues, all the musculature that inserts the neck insert here. So the further in front my shoulder is, the more strain and irritation can be caused on this area right here. So we want to make sure that we have a support or a pillow between our arms, all right, or sleep on our back with a supported pillow around a little high on our head there. Another key that you can add into sleeping is a pillow between your knees. Body pillows aren't that bad, right? We can hold them between our arms and we can stuff it between our knees. The knee pillow will actually prevent side sleepers from rolling onto their bellies, right? So the first thing I recommend my stomach sleepers do is try to get a body pillow or a pillow at least between their knees and their arms, to prevent them from rolling onto their bellies. All right, those are going to be things that really help out people that are having issues with sleeping, especially with the neck. Now, when it comes to the back, again, we want to stay away from undue long-term rotation of the spine when we're sleeping. So if we are in the fetal position with a pillow between the arms and knees, then we aren't going to be able to have that leg really roll over across the body. And that can really cause a lot of rotation on the lower back spine and kind of inhibit or restrict the quick progress we're hoping to see in lower back pain patients. Something else that stomach sleepers do that can irritate the low back, not only the neck, but the low back, is they have to lay there and they'll end up having a leg off to the side. So they're laying on their belly, one leg down, and then one leg out and bent. All right, and that can cause a lot of hip tightness. Right? You got to think. I mean, I tell my patients, think of sleeping as kind of like a cocoon. We do so much healing at night. We sleep for 8 hours. We're supposed to get 8 hours. We lay down, we rest, and we are in that position for the most part for about 8 hours. Yes, we may roll, we may twist and turn a little bit, but for the most part, we are doing a good amount of musculoskeletal healing during that 8-hour time frame. So we want to be in a beneficial position. And I preferably like the fetal position, side lying pillows, and lying on your back if need be, with maybe even a support under the lower back. All right, if you like videos like this, make sure to subscribe below.
You literally just described me like to a T.
Did I?
How I sleep, yeah. It's so comfy, but it's literally why I have all my problems.